A step 2 gait pattern is often used first when a patient is first learning a new assisted device and for those with weakness in their lower extremity, as this increases the amount of time during double stance. The step 2 gait pattern is often performed using a walker as shown here in the video. The patient is instructed to move the assisted device in the direction that they are traveling, making sure not to reach too far. Once the device is secured on the ground, the patient is instructed to stride out with their affected leg to the line of the assisted device, followed by the other leg to the level of the affected leg. The therapist will stand posterior to the patient while slightly being on the patient's weaker side. To provide the most support, the therapist should have a wide base of support with one hand securely on the gait belt and the other on the contralateral shoulder. A step-through gait pattern resembles a more natural gait pattern due to the patient being able to stride beyond the assisted device. This increase in stride length increases the time of swing phase, which in turn decreases the time in double stance. The step-through gait pattern is often performed using a single cane as shown here in the video. The patient is instructed to reach out with their cane that should be on their contralateral side of their affected limb, and at the same time the patient should stride out with their affected leg past the assisted device, followed by the unaffected leg, and repeated. The therapist should stand posteriorly and slightly to the patient's weaker side, with the therapist keeping their forearm at the level of the patient's center of mass and the other arm on the contralateral shoulder to help guide the trunk.
A swing 2 gait pattern is used when the patient has limited use of both lower extremities and/or trunk instability. This gait pattern requires the patient to have considerable amount of arm and upper body strength to support the entire body weight. The swing 2 gait pattern is usually performed with 2 crutches. The patient needs to bear weight on the unaffected leg, and then both crutches are advanced forward together at the same time. The patient should shift his or her weight forward while swinging the body to the position even with the crutches. The therapist will need to stand posterior and slightly to the side of the affected extremity. The therapist should also keep one arm at the level of the patient's center of mass and the other arm on the contralateral shoulder in order to direct the trunk when needed. A swing-through gait pattern is used when the patient has limited use of both lower extremities and/or trunk instability. This pattern is the fastest of all crutch gait patterns, therefore it is not as safe. The swing-through gait pattern is different from the swing-2 gait pattern only in that the body lands past the crutches with every step. To complete this gait pattern, both crutches are advanced forward at the same time, and the patient should shift his or her body weight onto their hands for support. Lift the leg and swing forward beyond the point of the crutch placement. The therapist will guard the patient similar to the step 2 gait pattern, trying not to impede forward progression.
The tripod alternating gait is typically used when a patient has a deficit which prevents the lower extremities from supporting or advancing the torso. Forearm crutches are typically the best assisted device since they allow the maximum maneuverability. The patient must have a well-developed upper body and core in order to successfully operate the forearm crutch. This technique is taught prior to attempting the tripod simultaneous technique. The patient first advances one crutch and then the other, followed by simultaneous advancement of the lower extremities. The trunk drags the lower extremities from the initial resting position to the final position of the advanced assisted device. Smaller steps are initially taken to facilitate a safe technique. While guarding the patient, the clinician should keep a broad base of support and be positioned in the posterior lateral position. A gait belt should be used to help advance movement or prevent falls. As mentioned previously, the tripod simultaneous technique is utilized once the tripod alternating technique has already been mastered. Forearm crutches are again utilized here, but standard crutches may be used. The tripod simultaneous technique is exactly the same as the tripod alternating technique, with the exception that both crutches are advanced simultaneously, followed by the dragging of both lower extremities, as seen here. Tripod simultaneous presents challenges as momentum is needed to advance the lower extremities. The clinician should be positioned in the posterior lateral position with a wide base of support. The clinician should be close, but not too close to impede movement.